Happy Wednesday, everyone. Let's see, let me go ahead and pin this. Hello. Thanks for joining. How's everyone doing today? Is everyone good? Hello. Thanks for joining me. Happy Wednesday. So glad to see that we have viewers here with us today. We'll get started in just a minute. Let's just wait to see if anyone else wants to join in. Is everyone having a good Wednesday so far? Let's see. Hello, Amanda. Hello. Okay, is everything pinned? Yes, we are all set. All right. Let's see if anyone else wants to join in. If not, we can go ahead and get started. Hello. Okay. All right, hello, happy Wednesday. So glad to be here today. My name is Ibukumale, and I use she, her pronouns. I am the social media program coordinator here at Whitman-Walker, and today I'm actually here to talk to you about sexual health as well as sexual health resources with testing in the DC DMV area. So as you've seen, the past few months, we have been expanding into the social media platform, and I come here as well as other people in the community health department, and we talk about different things. We talked about HIV, STI, safe sex practices. We talk a lot about COVID, as you've seen. We like to celebrate all the important holidays that are occurring around us, and just really raising awareness about different topics in relation to health care and sexual health. So today I'm actually here to talk to us about sexual health and also just point you in the direction of places to go to if you're looking for somewhere to get tested. So to begin, I just want to start off by defining what sex is and defining really what sexual health means and why it matters to us. So sex is a normal aspect of the human life, and it's important that we are all well informed about our sexual health. And this is for if you do have sexual activity and if you don't. It's important to know really what sexual health means and how to practice safe sex. So according to the World Health Organization, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. So it's not merely the absence of disease, dysfunction, or infirmity. So this means that even if you are not having sex, it's still important to keep up to date with your sexual health history because this is something that follows you everywhere. So sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences that are free of coercion, discrimination, and violence. So today I want to discuss STIs and the importance of getting frequent testing, as well as the resources that are available to you in the DMV area for free or affordable testing. So let's first start off by defining what an STI is. Anyone watching, do you know what an STI means? I think we have a viewer. Thanks for joining. But basically an STI is a sexually transmitted infection. So essentially an STI is something it's an infection that is transmitted during sexual contact. So that can be vaginal sex, it can be anal sex, it can be oral sex, but for this to be transmitted, there needs to be a sexual activity occurring. Thank you, Chenna, for answering. You're correct. STI means sexually transmitted infection. So there's a bunch of different sexually transmitted diseases that are affecting us in this world. But today I want to specifically talk about the STIs that we actually test for at Whitman-Walker. So we test for chlamydia, gonorrhea, and syphilis. And we offer free STI test kits that includes a urine sample, a rectal swab, and an oral swab for gonorrhea and chlamydia, as well as we do a blood draw to test you for syphilis. So you might be wondering, why do we care more about testing for chlamydia, gonorrhea, and syphilis? There's HPV, there's HIV, there's many other types of STIs that exist in the world, but why is it that we care the most about chlamydia, gonorrhea, and syphilis? So the main reason why our Whitman-Walker focuses on providing free testing for those is because in the DC area, chlamydia, gonorrhea, and syphilis are the most prevalent. So that means they're the most frequently diagnosed diseases in the DC area. So for us to reduce the numbers of people that are getting diagnosed with that, we chose to focus on those for testing. And also, an important reason why we focus on those three is because they can often be asymptomatic in individuals, meaning a lot of people can go years or months having these STIs and not even know they have it. So that's why we always push for frequent testing, because that's really the only way you can 100% guarantee that you're your up-to-date sexual health history. So one thing to note is that in an individual who's already diagnosed with syphilis, they will always test positive for the STI, but that does not mean they have that does not mean they currently have syphilis. It just means they're always going to test positive for it. And also, I just also want to note that HIV can also be asymptomatic for years. So that's why we also offer a free rapid test for HIV. We really don't want that to be a barrier for you to know your sexual history in regards to HIV. So now you might be wondering, how often should I get tested? Because I know there's different resources that say different things, but here at Whitman-Walker, we actually recommend you get tested every 3 months if you're sexually active. So our magical number that we say is the 3 months. So if you are sexually active and you have different partners, or you feel like you have different exposures, we recommend you come get tested every 3 months. That can change if you have a long-term partner that you only have sex with. You might not have to get tested as frequently. But if you have multiple partners, or you if you have an increased exposures to different individuals, we recommend getting tested every 3 months. So it's important you get tested because, like I mentioned before, you might not know you have an STI. Sometimes they don't show symptoms and they can go undiagnosed for a long time. And in that case, that can cause some more problems when these could be easily treated if you were diagnosed earlier. So at Whitman-Walker, we actually offer free confidential HIV and STI testing at both of our locations. So we're located at 1525 14th Street Northwest, and then we also have a location at the Max Robinson Center in Southeast DC, which is located in Anacostia. Currently, because of COVID, our sessions are only by appointment, so you can't walk in like you used to do before, but we actually made it pretty easy for you to make an appointment. So you just have to call us at 202-797-4439. So if you ever need to make an appointment, just give us a call, let us know what day you want to come in, and we'll find an appointment for you. Typically these appointments can take between 15 to 25 minutes, and like I said, your HIV test, you'll get it instantly, and then your STI results take about 5 to 7 days. And I know that sometimes we might be fully booked and you immediately need to get a test done. So I've compiled a list of other places you can go to. So you can go to Unity Health, which is located at 3020 14th Street Northwest. So they offer STI and HIV testing, and they are also on a walk-in appointment basis. You can call them at 202-469-4699. Their hours are pretty standard, so from 8 to 5, Monday through Friday. And then another place you can go to is Medics USA, which is located at 1700 17th Street Northwest. They also offer STI and HIV testing. Appointments are recommended, but you can also walk in. And like I mentioned before, they have standard hours, 9 to 5 or 9 to 4. Just make sure to call them at 202-483-4400. Okay, so Chenna, what is your question? Does one have to be? Hello, Charlie. Hello, I am forever_Pope. Nice to see you. Chana, do you mind rewording your question? Does one have to be? No, you don't have to be a DC resident to receive the testing. And also thank you for bringing up that question because our testing is free and our treatment is free, you also don't need to bring any insurance. We don't care about that. We don't need it. This is all a free comprehensive test for you. And no, you do not have to be a DC resident. You just have to be able to come to your appointment. That's all. Thank you for asking. So along with getting these tests from Whitman-Walker and the other health clinics I shared earlier, there's also an alternative. You can actually get tested at home. There are these tests that you can take in the safety of your home. And I think a benefit to this is you don't have to leave the house, especially now we're in a pandemic. So it's a little bit scary to leave the house for some individuals. So you can actually get tested while at home. And I think this is also a nice alternative for people who would like to get tested with their partners. You can actually get tested together and get your results together as well. These tests can actually range from $80 to $200, and you can purchase them at cvs.com, or there's also a website called everlywell.com. So you can order these tests there, and then they'll be delivered to your house, and you get your results right at home. So we do want to note that with these take-home tests, there could be user error. So if you feel like anything is inaccurate, if you feel like you had an exposure, but then you tested negative and you really feel like, or you're experiencing symptoms that could tell you that you have an STI, please do not hesitate to call us. We can always double check for you, and you could also make an appointment just to make sure that your results are up to date. Thanks everyone for joining. So does anyone have any questions for now about sexual health? I'm willing to answer any questions about sexual health, any resources I know. Let's see, does anyone have any questions before we conclude? Okay, so if we have no questions, I just want to reiterate the importance of having an up-to-date sexual health history. It's really important that you know this because, like I mentioned, a lot of STIs can be asymptomatic. And so just to protect yourself and your partners or your future partners, it's important to get tested. Especially if you are sexually active, we recommend getting tested every 3 months. So like we said, we try to make it really easy for you to get a test. So please just call us if you ever need an appointment. We love to talk to anyone, so you can call us and we are willing to just walk you through any questions you have. Thank you so much, Goldstein Bianca. Thank you, appreciate it. So before we go, that's really all I have to say today about sex and sexual health. But I do want to mention that we are still in a pandemic, so I still have to talk to us about the vaccine. So if you've already been vaccinated, we want to say congrats and thank you for, making the decision to protect yourself and the people around you. If you haven't been vaccinated and you are looking for an appointment, we do offer the COVID-19 vaccine as well as the booster here. So you can call us at 202-207-2480 to make an appointment, or you can also go to vaccines.gov. And I've actually found that website to be really helpful. I've helped other people get scheduled appointments. It's a pretty easy and user-friendly website, and you can basically find appointments around you for the vaccine or the booster. And this works for really anywhere in the country. And if you have not been vaccinated and you're not interested in getting vaccinated, we're just urging you to still continue to follow the CDC guidelines for quarantining, social distancing, and everything else. It's important that you do this to protect yourself as well as the people around you. Finally, I just want to say thank you so much for joining me here on this live today. Don't forget to check out our Instagram, TikTok, Twitter, YouTube. It's all at Whitman-Walker. And also check out our website. We offer so many other services apart from COVID stuff or anything with sexual health. We have a lot of different services that we offer. So please check us out. And like I said, if you want to call us, you can call us at 202-797-4439. Thank you. Have a good evening. Bye. Thanks for joining.